Thank you very much. It's a pleasure to be here and to celebrate. As much as an event in the conference, it's also a celebration of all of you. So I am really pleased to see what everyone has done here. We are really celebrating the physicians of the future and our vision for what healthcare can be in the wake of some major healthcare reforms that all of us are looking at today. 5 years ago, the department had received, with its 1115 Medicaid waiver, a commitment for about $250 million for the hospital medical home demonstration. And the funds were intended to improve patient care and primary care resident education ambulatory care sites. It's interesting when I think about the primary care, because I remember as a pediatric resident, it was like you have to go to primary care clinic, and little did I realize how important this would ultimately be. And no matter what we were doing, clinic was critical. It's like you had to leave and go to primary care clinic, and probably some of the best knowledge. And most of the questions I actually get today from friends and relatives usually relate around primary care, pediatric primary care questions. So here we are 5 years later, and guess what? We have achieved all the goals that we set out to achieve. We had 156 of our participating residency clinics have achieved PCMH recognition. 85% of our patients are getting screened for depression. 90% are getting prompt referrals to see a behavioral health provider. 73% are getting a post-discharge follow-up call within 48 hours. And we've also experienced about an 80% reduction in C-sections and early inductions without medical indications. These are major measures of improvement in patient care, and they're improvements that truly do deserve to be celebrated by everybody. So I would give everyone a round of applause for everything that you've all done. Well done. And this is, though, no time to sort of rest our laurels and say, we're done. New York's healthcare delivery system is immersed in transformations right now, which are, and every time I talk about this to everyone, I sort of say, are we in that much of a transformation, or is it just that I'm sitting in a role where I see it? But when you talk to those who have been around for a long time, they say that this is one of the real transformation moments for the country, but surely for New York. Changes that are going on alter not only the way we deliver healthcare, but the way we pay for healthcare, and even the way we think about healthcare as well. The hospital medical home demonstration project may be over, but what we've achieved will have lasting effects from now going forward. These effects intersect and support multiple initiatives that are underway right now in New York State, and we really recognize the effects that this will have. Many of you have heard of DSRIP, or the Delivery System Reform Incentive Payment Program. This was an acronym which, when I arrived on the scene, I didn't realize how many times I would say that word. The goal of DSRIP is to reduce the avoidable hospitalizations by about 25% in 5 years. And to do that, hospital providers, community groups across the state have banded together to form the 25 PPSs, or provider systems, PPS, another one of those acronyms, which are working together to achieve this goal. And each PPS must meet the specific outcomes to secure any funding. Yesterday, Jason and I were talking at length about some of the challenges and the ways to achieve what we're going to do. They'll be measuring potentially preventable ER visits and readmissions, as well as prevention quality indicators for adults as well as children. The goal is to shift the focus of care away from the emergency department and inpatient settings to more comprehensive care in ambulatory and community settings. Just the other day, I took one of my friends to the emergency room late at night for a cut on her head. And I was sitting there looking in the emergency room and listening, just overhearing some of the conversations of what people were coming in, what kind of complaints they were coming in for. And I said the goal here is to make sure the emergency room is used for other purposes. Although you could say the cut on the head could have been seen, but at 1:30 in the morning, and you say this needs to be sewed up. So a key strategy of DSRIP is to support the broad development of high-quality primary care using the latest patient-centered medical home standards as a guide. And that kind of care is exactly what we've taught the 5,000 residents in the hospital medical home project. Providers working in teams coordinating care with an eye towards population health and using data to make improvements in care. It's a new way of thinking about what doctors and healthcare can do. And as you can see, none of this was going to work without a major change in the way we thought about healthcare in general. We know that in order to make the changes, we have to transition from a system that takes care of the acutely ill and sick person to one that prevents one from getting chronically ill and if they are chronically ill, to get them better quicker, and to make sure that all the efforts are made directed towards that goal. We have to train our residents to think in terms of defined by the state's prevention agenda, an idea that is long overdue. I mean, I will tell you that this issue of prevention was something which years ago we didn't focus on that much, and I think that this is a major initiative here. I will tell you, even years before that, when I was like 6 or 8 years old, I remember sitting in the Catskills with my grandparents and my grandmother. She'd have this little book that she'd get every month called Prevention. And I'd look at it and I said, Nana, what are you doing? She goes, this is the answer to everything. You have to prevent. I said, she said, no, I'm telling you, if you're going to be a doctor, this is the answer to everything. It's to prevent the problems from starting. And so here we are, decades later. She'd probably be thrilled to know that that's what I'm talking about. New York has gotten wise to the importance of prevention and built it into its public health policy. The prevention agenda, the prevention initiatives that we have 5 main goals. Gus Burkett has been, and his team has been incredibly diligent in moving forward on this, and the whole department in general, to prevent chronic disease like diabetes, obesity, and heart disease, to promote a healthy and safe environment. This is also a critically important component. To promote healthy women, infants, and children, to promote mental health and prevent substance abuse, which are inextricably linked. And we are looking at this. The other day I had a meeting with a lot of the behavioral health experts in the state to discuss how do we tackle some of these things. And also to prevent HIV, sexually transmitted diseases, vaccine-preventable illnesses, and healthcare-associated infections as well. So the prevention agenda sets the stage for the state's most far-reaching endeavor yet, which is the SHIP, the State Health Innovation Plan. The other day someone said to me that the SHIP was moving at warp speed like Spock and Star Trek, and it is moving, and is the latest step in our transformation. It's going to help us align and coordinate all the initiatives now underway in the state, which includes our ongoing Medicaid reforms. But it's also going to ensure that all the initiatives complement one another. Because none of these things work in isolation. They truly work together. And it'll align incentives so the clinicians and other providers are supported in their effort to keep people healthy, not just for treating and testing those who are sick, but also for making sure people are prevented from getting ill in the first place. And last year we received a $100 million state innovation model, or the SIM testing grant from CMMI, that will allow us to implement the SHIP as well. So we like to think of this $100 million as sort of a down payment, and the SHIP has 3 overarching goals. So one is we have to be ranked in the top 25% of states for best practices and outcomes in disease prevention and health improvement. That's the first one. The second one is we want to achieve high standards for quality and patient experience. And 3, we want to shift care to the most appropriate settings. So to achieve these broad, sweeping goals, we have 3 specific strategies that we'll be pursuing in the next 5 years. So the first one of those is that we want 80% of the state's entire population to receive primary care in an advanced primary care setting, with an added focus on population health and integrated behavioral health, as I mentioned before. Second, we want to have 80% of the care paid for under a value-based financial arrangement. And finally, we want to have patients and consumers making more informed decisions about their care, with more transparency about costs and quality of care. And believe me, the transparency of things, we recognize this all. I had to have a disc fixed in my neck, and I've gone through the healthcare system recently, and I've seen every single possible component that you can think of, from the bills and the insurance and the phone calls and all of that. And so I sometimes sit there and think about this, and I say, if I can't figure this out, and I'm supposed to be one of those who can figure out, I know the whole system, and how does the person who is not part of the system figure some of these things out? And New York has very ambitious goals. So we recognize how we're going to get from one step here to there. So the SHIP has at its core the advanced primary care model, which builds on the NCQA's patient-centered medical home. But becoming an APC will take steps and stages to get there. But in the end, at the highest levels, an APC will be effective in the integration of behavioral health, the coordination of patient care, and the management of population health in general. So these practices will be paid through an increasing level of value-based payments over time. New York is well situated to deliver on the APC, which is essentially an amped-up version of the patient-centered medical home. In fact, we've made significant progress, and we have built, which we have to build upon, but we have achievements in the hospital medical home demonstration, obviously, and 30% of our primary care providers are already NCQA recognized patient-centered medical homes, more than any other state in the nation. So we should be very pleased about that. Of those New York providers who are NCQA recognized, 90% are at the highest level, which is level 3. That means they are more likely to identify high-risk patients, have team-based care management practices, and closely manage patients' transitions of care. New York plans to create the APC model built on numerous multi-payer primary care initiatives already taking place in different regions across the state, and I've had an opportunity to travel around the state to hear and see some of the efforts that are being made. And the doctors who will be working at these APCs and leading this transformation, well, they are really, who are they? They're all of you guys out there who are working closely with residents coming out of the hospital medical home demonstration projects. This is where it all begins, and it really does begin at a grassroots level and begins with those who are working on the front lines. 17% of the nation's residency program graduates come out of the New York State program. So that's an enormous amount. These new doctors will already be familiar with the patient-centered medical home model, which is exactly where you need to start right at the beginning. They will already know how to weave behavioral health into a primary care setting. They will know how to use the electronic health records to maximize the effectiveness of practice, and they will be the first to demonstrate that the model of care works to improve health. And I think that we mentioned about the electronic health records, and I think it's really important that we realize that all this is really tied together. Studies show that the patient-centered medical homes lower the cost of care, reduce the use of unnecessary or avoidable services. In addition, they improve patient access to care and patient satisfaction. So we predict by 2019, 90% of our primary care practices in New York will be well on their way to becoming APCs. And APCs are also training doctors to be accountable for how they practice medicine. And I know there's a lot of challenges out there for doctors today, and I recognize there's so much that's being asked of you, but I think this is one of the key ways that we can move forward. The APCs, the doctors will know how to work in a system that pays for value and not volume, and this is what's the most important. Obviously, we all want to give the best quality care to our patients. And they will understand that accountability and measurements are not just a good thing to do, but also part of our new payment structure. So before I leave, I want to say a heartfelt thank you to all those who made this demonstration project possible. I thank